I live in Idaho. I'm living in rural America. We have farm country. We deplete our environment, that's going to impact income. We already know that if you deplete income, it impacts health and well-being. We know that if you undercut the health and well-being of people, it undercuts education outcomes and income. So I think that just like we think about ourselves as whole people, spirit, mind, body, our relationships, our whole lives as whole people, so are our communities whole. And if you deplete any one form of health or wealth for long enough, it will pull the others down. James Rouse, who did Faneuil Hall in Boston, the great developer, familiar with him, he was a mentor of mine early in his life, my life before he passed. He's always said that a healthy community is a garden to grow people in. How do we make sure our workforce is really ready to meet these needs right now of so much deferred care and suffering that has not been met? What does the workforce of the future look like when less of it is inside the delivery system and more of it is in our schools and workplaces and places of worship and senior centers? More is happening out in the community. What is that workforce? I think there's a real opportunity to be thinking about that workforce of the future in the context of the integrated delivery system of the future. So care for the people we have now, think about and build the pipelines for the workforce of the future, and how do we distribute those skills broadly so that all of us have these skills. We all become our own first responder for and with each other. That starts to sound like community. Wellbeing Trust, just so you know, was founded by Providence 5 years ago when it joined with St. Joe's Health System. Their admonition to us is it's really one of the most beautiful things I've ever heard or received. We can't tell you what to do because we don't know. But we ask that you take prudent risks for the poor and vulnerable by watching the signs of the times. What we then did was we reverse engineered social movement practice and looked at everything from suffrage 100 years ago to civil rights, to the war movement, to the environmental movement, what caused them to be successful or not. And we found 7 elements: strong, clear vision and leadership, data, policy mechanisms that allow you to shift policy to pay for or enable, remove barriers, whatever. Pathways for community people to create distributed leadership, right? We can do collective leadership and distributed leadership. As we were talking about the civil rights movement. You didn't have to march with Dr. King to want to stand for civil rights. We need to bring more money into the field. We identified 7 nodes that were key to an effective movement nationally and regionally. Think a little bit about how are we doing on leadership, data, policy, communications alignment and measurement, pathways for people to get engaged, these kind of aspects of local movements that enable distributed action. Community, care, and coverage. First piece, so everything we do sort of fits in this. We need ecosystems, which you are in fact building, right? That have care delivery, but schools and faith and providers and data systems and increasing use of telehealth and other resources that together make sure that we increasingly meet the need in a clinical communicated way. Okay, so the first part is care. And I think this is relevant for your community, is we got to get the care right. Integrated, whole person care, no wrong door, with the assessment and referral of social needs, economic needs, as a standard of quality. Get the care right. Secondly, get it paid for. Next slide. That's the coverage part of our 3 buckets: care, coverage, and community. We've got to get the care right and got to get it paid for, including policies that the question is, how do you create communities as gardens to grow people in? What does it look like to invest in the conditions that would reduce the prevalence of mental health and addiction challenges or health challenges in the first place, because you've done the work up front? We need more professionals. Check. We need to create pathways to those roles. Absolutely. But we are not going to professionalize ourselves out of the ills that we face. We think there's living wage jobs in that, empowerment for people who've been excluded, lived experience that wants to be brought to bear, and untapped resources in communities that are full of gifts and assets that are a way to help transform what's driving our well-being in the first place as whole people.